I'm Leland Vitter. Time now for Sunday House Call.
And I'm Molly Line. Welcome. Joining us, Dr. Mark Siegel, professor of medicine at NYU's Langone Medical Center, also the author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health.
And Dr. David Samadi, chairman and professor of urology at Lenox Hill Hospital and chief there of robotic surgery.
How are you guys?
Hi, good to see you guys.
Yeah, good to see you guys. Thank you so much for joining us.
Happy Sunday.
Thanks for being here. You know, the big news story here that had happened over the past week is the death of Robin Williams. We wanted to play a clip of him that I think everyone will remember and then begin talking.
Medicine, law, business, engineering, these are noble pursuits and necessary to sustain life. But poetry, beauty, romance, love, these are what we stay alive for. To quote from Whitman, "O me, O life of the questions of these recurring, of the endless trains of the faithless, of cities filled with the foolish, what good amid these, O me, O life?" Answer, that you are here, that life exists and identity, that the powerful play goes on and you may contribute a verse.
That was a scene, of course, from Dead Poets Society starring the late Robin Williams, just one of his many iconic movie roles. Williams passed away last weekend at the age of 63, a coroner's report revealing that he hanged himself. His family saying Williams had been battling with depression and anxiety and that he was also recently diagnosed with Parkinson's disease. So we'll begin with Dr. Siegel on that. Your thoughts, which is most likely to have played a stronger role? We know that he had a very long battle with addiction as well.
Well, I think, Molly, that's a great question. I think it's a combination of many factors. It's the drinking, it's the history of drug use, it's the severe depression he was suffering from. Then the Parkinson's disease has a very high association with worsening depression. Then he looks in the mirror and says, well, wait a minute, how long can I make those facial expressions? How long can I dance on stage? You know, how long can I make movements without trembling? But I have to tell you, I think an internist, a primary care doctor, is usually the first stop for this, and I'll tell you why. 60 or 70% of the people that come into my office are coming in for anxiety or depression-related issues. They may say they have a sore throat, they may say they have a cough, they may say they have a muscle ache, but 60 or 70% of the time they're not doing as well as I would like. They're anxious, they're depressed. And I've learned over the years, and I actually lost one of my best friends to suicide before I became a physician, and I've sent several people to the ER with suicidal thoughts and plan. And I've learned to look for hopelessness, to look for a plan. You know, you have suicidal thoughts, but do you have a plan? If someone has a plan in place, you have to get them emergency treatment. And, you know, you look also for weight loss, change in habits of behavior. Are they eating what they usually do? Are they exercising? What about their relationships? Are they withdrawing? Do you get a warning call from a family member saying, hey, you know, my husband, my wife is not acting right?
Well, something just doesn't feel right.
Right.
What you're saying. How often are these types of suicidal thoughts and then possibly even leading to suicide linked to a diagnosis? If you all of a sudden see a patient, you diagnose them with cancer or with some type of terminal illness or some type of life-changing illness like Parkinson's, how often does that trigger these kinds of things?
Well, that's a very important point that you're bringing in. And what you're saying is that really we should be treating depression exactly like heart disease or diabetes. There are signs and symptoms that we want people to know. For example, if there's a lack of sleep, if there's behavioral changes, all of a sudden the person is not interested in social activities, they're not eating well, they have this guilt and feeling of worthlessness. Let's say he had a deal that didn't go through. After the first season, they had to cancel the whole thing. Now, all of a sudden, he's not as useful. And then it goes on to anxiety and depression. The last chapter of this whole thing is really suicide. So what we want people to know is to recognize the same signs and symptoms. And there's also 1-800-273-TALK. If you see someone that is suffering from these kind of symptoms, don't leave them alone. You want to make sure that you get help. Call 1-800-273-TALK, and I will post this on the Facebook. It's extremely important. One of the things that he said in one of the movies is that when you treat a disease, this is Robin Williams, when you treat a disease, you either win or you lose. When you treat the whole person, I'll guarantee you, you win. And we had a chance to save him. He came for a rehab. You have to look at his life, guys. He was suffering from depression. So all this risks were there. This is a person who had the addiction, and I think John Belushi actually saved his life, delayed the whole process for about 20 years. Parkinson's. He also went through 3 marriages, which by itself, it could be a risk factor. We know that as a comedian, now there's 2 times higher risk of suicide. How long are you going to leave that kind of hyper energy, kind of almost manic? Remember in the movie Good Morning Vietnam, keeping that up for on and on and on.
How often do you see that, Dr. Siegel, in terms of when you have people who appear so happy, who appear to be the life of the party? Is that oftentimes a mask for a depressed person?
There's no question about that. It's a great point, and I think in his case, by the way, there was a lot of warning signs about look at the roles he played. Not only comedic, he played Patch Adams, who's a physician who was in a mental institution, literally, then went back and became heartfelt, you know, and learned to take care of people emotionally, which in a way, I think he was looking for a Patch Adams in his own life. I don't know if he had it or not, but I think maybe he was making the world smile because he couldn't smile. And I want to emphasize a point David made. This is a disease. It's got a lot of stigma attached to it. It is a disease. There's been a lot of talk on TV, you know, was he selfish because people were hurt in his wake? It's not how you look at it. It's a disease. We have to take care of it. The earlier we find it, the better. If it gets treated early enough with antidepressants, with psychotherapy, with cognitive behavioral therapy, you can make a difference.
Let me just add one more thing that we just didn't mention. In 2009, he underwent aortic valve replacement, which was a heart surgery, and there's also a real depression that comes after a lot of these major surgeries.
And he's far from alone. There are so many other people suffering the same sort of challenges in life.
Exactly the point of covering this segment is that we want people to be aware of these patients. Don't leave them alone. There's a treatment for depression. They can get well, but just diagnosing it is a lot important, and you can save lives. These are the people that almost live 2 lives. They're happy in the morning, and they're basically locked in their own dark side cage. And suicide is an escape. It's basically just getting rid of this pain that they live with.
And the Parkinson's side, by the way, Parkinson's patients tend to do very well on antidepressants. So the fact that he had it, and another interesting fact about that is you get it before you get the symptoms. The brain hormones changes. So even before you see it, and I actually talked to a top neurologist, Parkinson's expert, who said he could see in Robin Williams' face, in the crazy ones, some early signs of Parkinson's. But even before you start to lose the motor function, you can respond to the antidepressants.
Right, great. Thank you very much. Yeah, Dr. Samadi just provided me here with a number, and you had mentioned a number earlier today, 1-800-273-TALK, T-A-L-K.
Ask for help.
And ask for help. And that's, you know, not just for the people that are suffering that might be thinking about suicide, but it's so difficult for people that are watching their loved ones suffer.
Exactly, Molly. Family members.
Some guidance
Well,
as to how
it gives family members some place to be able to go and to look for help and hopefully not end up in the situation that Robin Williams found their families in.
Absolutely.